So we believe that this recorded video was very informative to everyone. So now it is the time for any burning questions or queries you might be having based on the session. Dr. Siddharth, would you like to unmute and express your...
Yeah, I think I have written in comments as well that the talk was quite informative and looked like a skill development program. And indeed, sir has actually expressed his views and has actually given a very good insight with respect to the anger management and how to ventilate the anger. He did show, I think, if you look at the examples of the patient inside, he did talk about Mr. X and he came with multiple queries and he didn't know about the disease itself. But I'm still surprised in this existing era of today, still the people are giving, I mean, they are not well aware of the things. Probably there is a barrier which is from our side also, but then it is from the patient side also. And I think he gave a consent to go for the surgery, which itself felt me, it was an implied consent. So probably somewhere around, he knew what was going around. So, but yes, digging the history, yes, I agree, we will know more information. But I still was a little disappointed with the patient's insights being shown, and they were multiple. And I felt there is still a barrier which is there, probably, which is existing in our side, probably our medical side or somewhere else. This is what I wanted to convey, actually. But I felt it was a great talk and it was quite informative.
Thank you, Dr. Siddhartha. Any more comments?
I just wanted to make a comment. First of all, I want to thank Dr. Raghavan so much for an excellent lecture, especially about the individualized approach to telling the truth to the patient. Just wanted to give a different perspective because I come from a medical culture where the patient is jumping to know. You know, they're calling me and asking me, you know, our office is like, what's the test result? What do I have? So that has never been a problem for us in terms of telling the truth or knowing whether the patient wants to know the truth. But for the last 10 years, I have been seeing patients in India via telehealth. And I have always been faced with this conundrum because there's this cultural thing, both medically and in the public, that you don't tell the truth. But what I have found very useful was exactly what Dr. Biju was saying, which was simply to ask the patient every single time. But 100% of my patients in India have said, yes, I want to know, even if it is serious. So I have a difficult time accepting this initial concept that he had said that we need to collude with the family and that it is not our job to challenge that belief, because in that way we are placing the family at a higher level, their needs at a higher level than the patient's. Because if the family is saying don't tell the patient, but we haven't even asked the patient if the patient wants to know. What if the patient wants to know and the family is telling you not to tell them, right? So you have to prioritize whose wishes are you going to take into account? Is the family's wish more important or is the patient's wish more important? So if somebody could comment on that from an Indian perspective in India, with regard when you're faced with a situation like that, because right now I am faced with a situation like this where I have a family member with glioblastoma multiforme, and the family just refuses to simply say anything to this patient. And nobody has asked the patient if this patient wants to know. Devastating disease that the patient is being told that, oh, it is a small lump in your brain. So how do you, in the cultural context, address this situation? Thank you.
I would like the comments from any of you before I comment on that.
Practice here in India, it is actually fairly common to see the patient and the family, they're not very desirous of knowing what the exact diagnosis is. A lot of the times the relatives will say, "Ki, don't tell them right now." And the patient will also tell you, "Ki, don't tell the relatives ki, what the diagnosis is." Collusion works on both sides. It is not just from the family side that you're getting this. We tend to tell the relatives ki, if the patient asks us, definitely we will tell them what the diagnosis is, what the prognosis is. But for the informed consent, it is you have to tell the patient what they want to know. Like Sir said very correctly, they have a right to know and they have a right not to know.
Right.
You don't have to give them all the information, only what they ask you or what they're comfortable with receiving and what they're comfortable with processing, you need to share.
I absolutely, I fully understand, they do have the right to not to know, but we have to find out from them, right? Do they want to know or not want to know? Right now, I don't even have the opportunity to ask the patient, do you want to know? Because the family is like, oh, don't tell them, don't tell Appa. Appa is in another room, and you're here as a person who's going to get chemotherapy, radiation, surgery, all this other stuff. So how I want to know from the doctors practicing in India, when you're faced with this situation, and how do you even ask the patient, do you want to know this, if anybody can
How about the warning shot Sir has just said? Like, if you come across the patient and you say about a warning shot, like he said, like, would you like to know about the disease, or are you like worried or something like that? Like, put up a
sure, right. But then
that's
we're no longer colluding with the family, right? That is what the I guess the dichotomy or the incongruency I'm seeing is the original part of the talk said that do not continue to collude with the family. So it kind of brings this difficult situation. Anyway, I understand this is a tough situation. Put that out there.
So I just want to tell you that this is a very, very common situation that all the, at least we face here at Trivandrum, and I am sure all of the Indian doctors face this very, very difficult situation. Even before the patient comes, the family member will come to tell you that please don't tell. So that's the situation. And maybe you can handle it. Dr. Biju told by continue to collude with family, or otherwise we can first empathize with the family. Okay, I understand you are very much concerned about this, and yeah, we can understand that. And I understand that you want to do good for your father or mother, and we also want to do good for your mother or father. So let's work together to resolve this difficult problem or issue. So that might be another way, but still we are in a situation where we are in a pit where we are unable to come off that. So then, as I told, we can talk about that. Then we are at least will be able to talk about that. Otherwise, if you right away reject, no, it's not ethical and things like that, then the family is going to be, I don't know, probably they may not, they will tell you that, okay, if you are going to tell, we are going. We don't want to be here. So that's another thing. So even with this difficulties, we continue to each of us understand that autonomy is very important and it's the patient's right to know. But as you told, in this culture, actually, the patient is not the only person who is coming to see the doctor. and the family is accompanying the patient throughout the course of illness. And so there is an autonomy of the family also, which we need to be respected. Even though we understand that autonomy of the patient is the most supreme ethical factor. So it's a difficult situation, but still we continue to work with family to make them understand that, okay, the patient need to know. And sometime after the first conversation, most of the caregivers would tell you that, okay, we understand the importance, but as of now, we don't want to tell. I want to discuss it with my brother or sister or somebody else, and maybe a few percentage of caregivers might tell you that, okay, I understand, you can go ahead and tell. And there are a few caregivers who never wanted to disclose, and then the situation becomes very difficult, because whenever we go to see the patients, sometimes patient may directly ask you, why my problem is not reduced, what is the problem with me. And in such situation, the doctor or the medical person who is going, maybe a nurse or a social worker, it's very difficult for them, and they have to escape from that situation, or they have to change the subject to something else, pretending that, no, I haven't had what you are talking. And then they will go and talk to the family that now the patient has asked us this question, and we will not be able to go and see him next day, because if you don't talk to him next day, then they are not going to trust us. So trust is gone, and now he's here, and he may think that this doctor doesn't know anything, and that's why he is not talking about my disease. So this is how we manages the family to allow us to talk to the patient. And somebody might tell you that, okay, you don't talk about cancer, but you can tell that it's some ulcer or something like that. So we'll tell, no. Anyway, telling lies is not possible, and it is not ethical for us. So this is how we are managing the situation. And but if you continue to persist with the caregiver, they will allow you, because they understand after some time. Even a few days back, we had a young patient here, I think about a 25 or 26-year-old man, who had a malignancy, advanced malignancy, and he was in the final days of his life. And his brother do not want to reveal the diagnosis. And we talked with him many times, but he was not willing. But because he himself told what his experience was with other doctors. Then we talked to him and told him how we are going to tell this news and things like that. So he asked what would be the advantage of knowing this. So there are many questions which you have to face.
Sure.
And you have to understand that it is because they love their loved ones. That's why they don't want us to reveal the diagnosis. So at last he agreed to tell the news, but it took long time. So this is what happens usually.
Thank you. Thank you so much. I appreciate it. Can I ask you one other thing? Like when the patient is saying, what is wrong with me? You were mentioning that situation where the family is not allowing you to say, but the patient is saying, what is wrong with me? Do you think it is appropriate at that point to say, hey, your family is not letting me say anything to you? Or is that no?
No, we don't tell that.
You don't say that. Okay.
What we tell that time is, okay, we need to get some more report from your doctor or your family. We will go through it in detail and we'll come and tell you. So, and then we have to talk with this is just buying time. to talk to the family, to tell it the patient. So this is very tricky, and there is a study actually, I think from Tata Memorial Cancer Center, where they interviewed patients as well as caregivers, and they asked many questions to the patients. Would you like to know the disease? And I think more than 90% of the patients told that, okay, we want to know. But the
Yes.
same question was asked to the family member, and only
Yes.
30% of them told, okay, we would allow them to know. So that's the difference.
Right.
Actually, when one of our loved one becomes a patient, we don't want to tell. But if you ask me at the same time, do you want to know? Yes, I want to know. So
Exactly.
that's the problem.
Right. Thank you. Thank you so much.
If no one else is having anything to share, maybe we can wind up for the day, Dr. Sunil, with your permission. We believe that this was an eye-opening session because communication is always the key to any field of life, be it your personal relationships, be it your professional relationships. Communication plays the key role, and we believe that this session might be a first step for you all to learn better communication, keep improving your skills. So with the promise that we'll be meeting again tomorrow with yet another very different and important topic. This is Sripriya along with Dr. Sunil Kumar signing from the Pipsi Club. See you tomorrow. Till then, everyone take care. Bye-bye.